Hi, everyone. Welcome to the Fullest podcast. I'm your host, Nikki Bostwick, and today's guest is Dr. Sami, who's a dual specialized pediatric dentist and orthodontist. She has a bachelor and a master in psychology, and she's the co-founder of Beehive of Healing. Hi, Dr. Sami.
Hello, everybody. Hi, Nikki. It's such a great pleasure to be with you and to do this talk finally. I'm very excited.
I'm really excited too because I've worked with your husband for so long and I'd only heard just the most wonderful things about you. And then once I had my son Truth, I had the privilege of coming to you and working with you. And that was such an incredible experience, especially given his, his genetic condition that we discussed and your, just being in a room with you and your counseling with Eric and I was so beautiful. And it really came back to trusting and not having this sense of fear, especially about our experience of like what happened early on when we found out and just your recommendations to us and how everything played out. It was just so beautiful. And it's funny because I feel like a lot of times there's a quote that says, behind every strong man is an even stronger woman. And I felt like in that instance, I was like, wow, this woman is so soft and so knowledgeable and just like everything that I love about people and human beings. So it's just such a privilege to have you on and share you and your knowledge with our audience. Thank you so much.
Thank you. I'm humbled by all of that and grateful for receiving and experiencing me in that position. That is my intention at all times, to be of service to my families and beyond. And it's a great feeling when it has a beautiful landing in that capacity. So thank you.
Thank you. And yeah, so I kind of wanted to start with a little bit of a background. Like I mentioned in the beginning just a second ago, you have a really varied background, and it's not just in dentistry and orthodontics. You have this holistic perspective that is still so different than what someone would call another holistic dentist. Like I think that's definitely trending right now to go visit and see a holistic dentist, but I've been to several and none of them are like you. And you have a totally different perspective. And so I think it's important to discuss and kind of unwind and think about how you got to where you are today. Mm-hmm. I'd love to kind of hear and learn about your journey and if it came to you intuitively the way you view things, and that's why you navigated your journey towards psychology and all those things, or it just happened to come together?
A little bit of both. I grew up with a mom who was a psychologist, and also, she was doing Louise Hay's mirror work in our, leading a group of people when I was 11 years old. I distinctly remember. So I had a lot of exposure to psychology. When I went to college, although I was majoring in biochemistry, I just took so many psychology classes just because that was kind of like my break from the brainy world, or whatever you want to call it. Like just so yoga and psychology classes became like my fun classes to take. And I took so many that they ended up like giving me a psychology bachelor. So it was the interest and the curiosity. But I think that the most important aspect of my journey has been to stay humble and curious, because I think a lot of people, like once they go to any kind of, whether it's a higher education or they become a doctor, they lose that curiosity and they just continuously fall back into what they learned in school. And and the limitation of what they learned in school. And, I distinctly remember that one of my professor at Columbia University, the first year, he kind of brought this gigantic book and he says, you are going to learn more than 10,000 vocabulary in 1 year. And you need to be able to memorize everything from the first page to the last. And knowing that in 10 years, this is going to be completely obsolete. And what we're going to know about health is going to be very different than what this book is representing. And I don't know too many medical schools that they actually talk about that, but I was really grateful that we did. And then also another professor, he said, don't become tooth carpenters. It doesn't take a genius to make a hole in the tooth and go fill it. You need to be able to see the cranium, the head and the neck, without even like taking an x-ray. So start like looking beyond the tissue, beyond like, and just remain curious. And I started like looking at all of these things and got further training in osteopathy, food as medicine, anthroposophical medicine, just so many different homeopathy, just as much as I could get my hands on and learn. It was, I just kind of went through it. And then they all kind of came together in a beautiful way, because the more that I learn, and I'm still learning, I feel like there's so much more that I don't know. But the more that you learn, the more question it comes forward for you. And it almost like that image of the elephant that they say, of the 12 blind men, that each person is like touching one part of the elephant and describing the entire elephant as how they're touching it. I think that's how medicine has become. The medicine has become in a way that we only look at our own specialty and we don't consider the whole person.
Yeah.
And we don't consider the person at all from most of the time in the traditional medicine or dentistry, we only look at physical. We're even scared of looking at emotional and mental and forget about spiritual, right? So it's, I feel that it allows me to have such a beautiful and profound experience where I can see the person, the child, not just as a physical being, but also an emotional and mental and a spiritual being within the context of the matrix of the family. Because, for example, for your precious son, all the stuff that you have gone through, all the emotional baggage that you bring forward, all the family drama and trauma and intergenerational things that you and your generation, as well as your beloved, bring through, it all makes it all makes an impact on that child. And we've never spoken about those things unless you're a psychologist. We've never spoken about those things as a physician, as a dentist, as a doctor. It's like, okay, who are you in a bigger, matrix of things? Much like, your body is 3/4 microbiome of viruses and bacterias and all of these amazing things that they collaborate, and only 1/3 of you is, or 1/4 of you is actually cells. So how is all of this thing works together is the dynamic of creating a healthy person. And much like that, it's the same as the mind, body, spirit, or however you want to describe it, in all those levels. So that's how it came about. It was just that curiosity and then continuous learning and remaining humble, because the more you learn, the more you understand that you don't know anything. So, and you want to learn more.
Yeah. And I love that. And I love the way that you brought it all in. And it does sound so intuitive, but also informed and science backed. And I'm curious, like, once you started learning about all those different healing modalities and, like you said, homeopathy, food as medicine, and the way ancestral trauma and healing and all that like plays a role, did you find that there were very many studies on things like we had talked about earlier, like the neurobiology or the microbiology of the mouth and how it's all connected? Or did you find that it was really only within your own practice that you could really hone those ideas and like evaluate just your own patients and where they came from? I mean, I'm sure it's a combination of both, but it just feels so rare to find that information.
Yes, absolutely. So it was both. It was the parts that I would kind of put together in terms of what the research had been done, and what was in the past discussed through books, or even like rare books. For example, like just giving you a tiny example, about 16 or so years ago, I found this tiny 60-page book that was like completely out of print, all about xylitol, right? And all about like the benefits of xylitol in the nose and in the back of the throat, and the anti-strep and the coating and the moisturizing, all of that stuff. At that time, at least, like it was never really discussed anything about xylitol, at least in medical and dental school. And there was never any evidence that they were talking about these things. So I looked at this and I started with myself and my kids, and just kind of like spraying xylitol. We made like a little xylitol, like with a small bottle, and add some xylitol sugar to it, and like spraying it into the nose and the back of the throat. And one I remember specifically with Hafez. So he was going to a really tiny school with like 144 kids. And out of this 144 kids, I think 130 of them, they got strep throat. And Hafez was one of the ones that you just like never missed school and never got a strep throat. So the principal like was sitting with me, and he's like, do you do anything that it's really interesting, because he hasn't even missed any day of school. So, and then they all share all of these things. And so is it something that you're doing at home that it's preventing him from getting? Is there any dietary stuff or any supplements? And I kind of noticed like, oh, this is exactly, as it actually talks about the anti-strep properties of xylitol in that little book. So then I started doing it with my patients and putting them on nose rinses, because you see the quality of cleaning out the nose and cleaning out the back of the throat. And I think it was about 3.5, 4 years ago, I went to a lecture at UCLA just to support my friend who was giving, her first lecture there. And like the speaker before that gave a whole talk about gut microbiome and xylitol and the whole aspects of prevention of what's called the PANDA, which is kind of like a strep-based autoimmune disease in children that they have seen. It was so fascinating, So there is that aspects of intuition, reading, and then coming back and first like applying it to myself and my 2 kids, our family. And then after that, kind of like going and experiencing with the patients, and also like kind of pushing the envelopes. It's for example, there was not in a way that it's out of practice for me, out of scope of my practice, but for example, like I'll give you an example, and I think I've given that example before as well. But one of my osteopathic friends came and told me, I think it must have been like 9 years ago, or 10 years ago, says, Sherry, can you please do this woman's tongue tie for me? And I said, I only see children. I don't really do, tongue tie releases and lip tie releases on adults. Just, send them to someone else. Because no, I specifically want you, because you also have an osteopathic feeling when you do your tongue tie releases. We'll do them myofunctional and I'll send them to you. Please do this as a favor to me. I said, okay. So I, received the woman and did her tongue tie release, and it was very successful. But she called me in 3 months and says it worked. I said, what worked? Yeah, the tongue tie was very successful. She has more range of motion, swallowing changed, neck, the feelings in her neck and the tiredness and all of the neck pain went away. She goes, no, she had a tilted uterus and I kept correcting it. And when you released her tongue tie, I was able to actually, and she had 6 miscarriages. And when you released the tongue tie, it actually stabilized her uterus after I would treat her. And I'm thinking, like, what does tongue tie have anything to do with a tilted uterus, And then so I started studying fascia and I started looking at all the fascia and how it's connected and how it goes, like, from your tongue actually goes. I have this amazing video that they did this dissection and how the fascia, which is the part that in medical school we just kind of like get through and we just cut it so we can get to the organs.
Wow.
We never have an appreciation for it. And it goes all the way to your toes, So I started like, oh, okay, then like there's a light bulb, So then I had another mom that, we had done the tongue tie and lip tie releases, but this 1.5-year-old kept like pushing forward his jaw and to the point that it would have become like a misalignment of his jaw. And I'm looking at the mom and the mom is really retruded. She needed a upper lip tie badly. And I said, well, there's a concept of mirror neurons and how our children, they want to imitate what they see, especially as a mother. Would you be open to do your upper lip release? And for your son,
Yeah.
You need it, but do you want to do it for your son, And she's like, yeah, I'm totally open to that. And so we did the upper lip release and it was really interesting. So she started walking out and she's like, there's something going on with my hip. I can't really walk. And then she gets down and takes off her shoes and takes like this 1-inch thing that she had in one of her shoes and start walking. And she's like, oh my God, I had like an inch of difference between my hips. So I had to wear this ledge in my shoes. And now it's like completely corrected.
Wow.
And then within 2.5 days, the boy stopped completely doing like this forward movement of his jaw, so it completely got corrected, which was so fascinating to me. Again, I just kind of remain humble for these patients to be my students, to be my teachers, and I be the student. But it's kind of like being open and with a listening that it requires in order to see it, in order to accept it, and not just like, yeah, that's just hokey pokey, or that's just doesn't make sense. It's like, yeah, it doesn't make sense to me, but let me study more. Let me learn more. Let me, let me find out a little bit more about it and just remain curious enough to be able to see if there is anything else. So I think it's very, very important to also have, I feel really blessed that I have been working, having my own practice for the past 15, 16 years, because it allowed all of those little ones and their parents, they became my teachers. And the whole aspects of it, not in a way that would compromise them in any ways, but the whole aspect of remaining like, oh yeah, that kid has a lot of sensory integration issues, and how is that related with the mouth? So let me go and study sensory integration and development and proprioceptions with a developmental pediatrician, so I can have a little bit better understanding and a better eye when I'm looking at a child, and then see if there's anything that we can change in here that changes their feelings in their extremities and their experience of their whole noise, hair, haircut, all those sensitivities that sometimes comes with sensory integration. So those are the ways that it kind of universe just lined everything up for me.
But God, it all is so amazing. And I feel like I have so many questions. But so let's talk about what you just brought up, sensory integration and how you would study it. If you noticed that there was a child who had a sensitivity to something like that, how would you work on them differently? I'm
So, first of all, I think the most important aspects of a patient's evaluation is is observations and touch, right? So when a child comes, I don't like right away, as you saw probably with your own child, I don't right away just put them back and start looking in their mouths. I try to like engage with them, like see how the eyes are working, see how their speech, if they're speaking, how the speech is working. It's like I do a lot of chit chat with the parents. Initially, might not understand like that. It's not a chit chat. Well, it's first like kind of gaining trust and establishing a little bit of a common ground. But more importantly, like I'm looking at the eyes, I'm looking at the breathing, I'm looking at the mouth, I'm looking at the functions of the muscles of the face. I'm looking at the neck. I'm looking at their hands. Is there bilateral? Is there an aspects of the midline that it's missing? I'm looking at the structure of the cranium, of their walking. There just so many little and tiny things that when I put my pink and strawberry gloves, is it too much for them to smell? Is it do they receive the touch on their face in it? Are they an easily gagger? So all of these little tiny things before I even put them down, they give me so much information. And then and I usually like not to look at the patient's information until I actually feel the patient myself. And then, like through the osteopathic feeling or just kind of palpating them, you get so much information about falls, asymmetries, even like, especially now that kids are on so much media. Like, I put my hands on their cranium and it's like buzzing, right?
Yeah.
They're just so it's too much. Like their brain, it almost feels like just overworked. One child specifically, I put my hand and I'm like, so how many hours a day are you on media, and including video games, you're zooming. And mom's like, mom is answering. He's not answering. Mom is answering. He's like, oh, about 3-4 hours. And I'm kind of thinking like, yeah, this brain doesn't feel like 3-4 hours a day. It feels a lot more. So I asked the mom, I was like, oh, do you mind going and getting a cup of water for yourself? This was a 9-year-old. So I said, hey, buddy, your brain is buzzing. So tell me the truth. How many hours are you on the media, including video games? And he's like, you got a pinky promise that you won't tell my mom? And I'm like, well, I'm kind of obligated to tell your mom, but we'll say it in a way that you won't get in trouble. So he goes, okay, deal. And he said, I put my clock at 12 a.m. once my parents are asleep, and I wake up and I go on the video game and I play video game until 6 a.m. in the morning. And then right before they wake up, I go to bed. And this body was so tired. And the parents had no idea, because he had video games in his room and he had figured it out when he can do it, that parents do not know, and before they wake up and after they go to sleep. And so he was and he had his headphones and everything, so it was all quiet. But these are the information that I get through just feeling them, and palpations and just some of the things that you kind of like, how tired is the body, how the adrenals are doing, perhaps. It's like, what does the body feel like, and then you go inside, and when you look at the mouth, you kind of start relating everything together in so many ways. The tonsils and how enlarged the tonsils out, what does it look like in terms of, and then I kind of move back once I see some of the symptoms. Then I move back into finding the cause, because that's what integrative medicine is. Like, you don't say, oh, your child has this symptom. It's like they are, let's say they're mouth breathing, or they have gut health issues, then you look back into like why, and the question of the why, which we kind of discussed with your beloved son, is like we need to go beyond just the symptom, because the symptom, I mean, everybody can see the symptom or diagnose the symptom, but the why is where it's going to take him really, really long and far. I have a person, for example, that I work with in, he does like some form of a neurofeedback, but he has kind of intelligently created this program where it's kind of like a boot camp, but it basically like, repeats all the turns that the baby was supposed to go through embryo, and they didn't quite, because either the mom had to be on bed rest, or there was restrictions in the uterus, or there was something that like the baby doesn't quite turned in the right way, so they were never able to do the tummy time. They had too much regurgitation. They were never able to crawl on all four, or they were tippy toe walking, or all of those like very subtle things that most pediatricians, they don't necessarily look at and they don't necessarily talk about, but then they make a profound neurological differences. So some of these things, like by incorporating it, it just completely changes the child and changes the trajectory of what they can do and how they grow in the future.
As you may or may not know, we've been sharing the benefits of saffron with our community for a little while now. Growing up in a Persian family, I'd been aware of the benefits of saffron because of its prevalence in my mother's cooking. But as we began on the journey to create our own line of saffron-based products, I began to learn the powerful science behind the plant. Saffron has been used by many cultures for thousands of years, and now the research is backing it up, proving that just 30 milligrams of saffron per day is a natural source for enhanced emotional and physical well-being. At the fullest, we believe that incorporating ancient wisdom into our modern lives is one of the most powerful and accessible paths to healing. We also believe that everyone's journey is unique. So for our latest launch, we've created a line of saffron products in a variety of formats to help you curate saffron in your personal daily routine. Warm Feelings is our saffron latte powder and comes in individual sachets and in larger sustainable glass jars. Made with just certified high-grade saffron, organic coconut powder, and cardamom, it's the perfect coffee alternative and feel-good start to your day. If you prefer to pop a pill, Kinder Thoughts is our 30-day supply of saffron capsules and a super simple way to support your body and mood with the power of saffron. And if you're looking to strengthen your immune system, try our Mindful Immunity Syrup. This healing blend uses saffron to reduce inflammation, but also harnesses the power of ancient Middle Eastern barberries to fight infection, along with sea buckthorn and elderberries, all in a base of manuka honey to aid in antibacterial healing. It's a true immunity powerhouse. Honestly, at the moment, I'm using each of these products on a daily basis depending on my needs. And to help you begin your own saffron journey, we're offering a discount of 15% off just for our podcast listeners with code TheFullestPodcast at checkout. I hope you enjoy your new daily saffron ritual. That's so true. I mean, you think about how they say, I mean, I'm sure to an extent, there are things that are normal, but it's like if a child is regurgitating a lot, or if a child is even like something as simple as hiccups, I feel like I remember my son would get so many hiccups to the point where I knew something wasn't like, it was way too often to be normal. But
food sensitivity.
What is it? Food
sensitivity.
Wow. And that was just me nursing him. But so then it's like, there's something that I'm eating as the mom that, he was sensitive to. And yeah, I think it's just so important to notice those things. But you just kind of go online and they just say that's normal because our normal is cute.
Yeah. Even hiccups, I don't know if you had hiccups during your pregnancy, but with both kids, they had so many hiccups during the pregnancy, and it was just kind of cute. It was like, oh, adorable. They're like your belly is jumping up and like, oh, that's a hiccup, and I didn't pay attention with Hafez, but I paid attention with Hannah. And it's exactly, and then we took the cord blood, which you should do when you actually like give birth.
Yeah.
Take the cord blood and do a sensitivity testing with it.
Wow.
So when you do that, it was exactly like, so when she would have a hiccup, I would actually have a food diary of what I ate, so like, okay, I ate this for the past day or, past day and a half or something like that. And when we got her food sensitivity, exactly the foods that she's sensitive to, and she's still sensitive to them, dairy, gluten, a couple of things, So it's basically like the ones that I would eat, once in a while or whatever it was, and then she would just she would have hiccups into them. So, but again, like just kind of remaining curious and then finding out all of these things, because let's say you doing, taking the cord blood and doing a food sensitivity testing out of it, it's not going to do any harm to her. It's just going to give you, or, is it a girl?
Yeah, it's a girl.
So it's just going to give you more information about what to eat and what not to eat, especially the first, while you're breastfeeding.
Yeah.
So it can have like the microbiome of a healthier gut rather than an inflammatory gut.
Yeah. And I think that's so important to note, because for me, like I was very interested in the Ayurvedic diet, and I made sure to eat very specifically so that I don't have things that set him off. I didn't eat onions. I didn't eat garlic. I didn't eat dairy for a long time. But it doesn't mean it, like, those are obviously the general ones, but it doesn't mean that there aren't these different things that they could be sensitive to. And to know that through the cord blood would make actually life easier, because then it's not like all of a sudden you're just eliminating everything as a new mom or postpartum and when you really need stuff. So that's such good advice. But yeah, I think that, all of these little things are so important. I just had a friend tell me she went to we go to see someone down here because you recommended when I saw you to go see someone, a chiropractor. She's a pediatric chiropractor that does like craniosacral therapy and stuff that's close to us. And she's amazing. And she picked up that my friend's son needs to be on the same homeopathic as her mother, because there was something that her mother dealt with. And now this person sees the mom and my friend and the son. And it's amazing to see how connected we all are, and how the grandmother is still playing a role, and healing what the grandmother was going through is also going to help heal the son.
It's incredible. Like I have this little boy that at least for the past 3 years, every year, like, around, I think past 2 years, every year around his dad's birthday, he gets a concussion on the right side of his face.
Wow.
And and I told the mom, like, I think we really need to work on that and get, like, because like the second time she came, I looked at my phone and I have more than 26,000 pictures on my phone, unfortunately, a lot of them like patient, kids, my own kids, all these things, and all the, different things that I do. But I looked at it and I was like, oh, last year was the same exact time that he had the concussion, and it was on the same side of the face. And she was like, no, I don't think so. I think it was on the other side. I said, no, I have his picture on my phone and it's on the same side of the face. So I pulled it up, and he looked, she's like, oh my God. And it's like, so let's look at it as a curiosity. It's for sure, but let's look at it, And she's like, oh, that's my husband's birthday, so, and this is the masculine side, the right side is the masculine, the left side is the feminine.
Wow.
Let's look at it. And we kind of like together dug a little bit deeper and a little bit more. And, so it's quite interesting when you start looking at some of these relationships, and I don't believe in, that maybe because of my spiritual background, I don't believe in coincidence. I just believe like there's a divine plan everywhere. So you can call it coincidence, but I call it synchronicities or messages, all of those things that at least it gives a deeper meaning than just coincidence. So, and it's a curiosity. It doesn't have to be like, yes, this is what's happening, but like, oh, let's look at it and see if there's any aspects of it. And when we do that, just like your friend and the homeopathics between the grandma and the grandchild, there is a lot of openings that might come forward that otherwise it wouldn't, and when you do that, there's like one more healing modality that you're offering. And then there's a deeper connections that it's just actually heals the intergenerational physical, mental, emotional, and spiritual aspects of things. And I think it's very powerful.
I think so too. It just made me think about too. This made me think about it, but who knows if it's related. But anyways, I find it interesting because my son, when he was born, had Cradlecap.
Mm-hmm.
Not a really bad case, but it was something that definitely bothered me, right? And it's something that I've found has stuck around with him because my pediatrician told me, like, some people say that it's connected to like yeast and fungal work that you need to do. And I was wondering, because now with his condition, like, we need to make sure that he has enough, his blood sugar is stable. And so sometimes especially at night when he's sick, and lately he's in preschool, so, he gets sick here and there pretty often. Actually, what's really interesting is every time a new kid joins the class, my son gets sick. And they're like all kind of learning and, incorporating each other's like different microbiomes and stuff. But anyways, he like recently started getting like thrush on his tongue. And I was thinking about how it goes back to the Cradlecap stuff. And there's definitely some sort of fungal something. And it's hard with his condition to manage because the sugar aspect, like, I need to make sure he has enough carbs. And I know that with, with something like a fungus, you really want to like starve that as much as
you don't want to starve the carb. You want to starve the sugar.
Yeah.
There's a big difference. And then also what you do is you mix the carb with a medium chain fatty acid. And when you do that, which is like coconut butter or almond butter. And when you do it, especially, like a pure one, not the ones that they add the cane,
not the MCT oil. Yeah.
Yes. But when you do that, then the processing of it completely changes because it gets into the cells, it gets into the brain cells specifically, and then it creates a different pathway than a simple carbohydrates and a sugar that just goes straight into the brain. And I mean, it's not into the brain, into the bloodstream, and creates like this high rise and then like a really, really quick down, falling down. So it's a little bit, but it's also the complementary aspects of the food, right? So it's not that, you and I, we don't have any fungus in our system. We do, but they have harmonized with the other bacteria and the other viruses and the other, aspects of our microbiome, and they created a system where they harmoniously live, much like, for example, that every day there's like several cancer cells that they come in, they're created, and then our body recognizes them and just kind of gets rid of them.
Yeah.
So looking at some of those things, for example, for the same token, I learned in one of the, so I used to do a lot of humanitarian trips. And when I would go in the middle of like nowhere, Honduras, Nicaragua, Guatemala, like there are all these medicine men and medicine women that they have so much experience with some of these things, and they actually treat, some of them with a lot of education. Some of them is just kind of passed generationally of things that they have worked, and they use a lot of herbs. But one of them, I remember he taught me that look at like put your finger in the person's ears and see how much wax buildup they have. And that wax buildup could be the fact that the patient has yeast in their system, overgrown of the yeast,
Totally.
So I put like my fingers on, patients, and I check, and then I write down, it's like, oh, wax buildup in the ears. And the parents are looking at me like, why is this dentist, orthodontist looking at the wax in the ears? I'm just looking for the disharmony. I'm not looking for anything wrong. I'm looking for a bigger picture
Yeah.
of where there is disharmony in the body that I can look at, and I bring more harmony into this whole person on all levels. And then the body knows its way to healing by itself,
Yeah.
right? And create more balance, more harmony in the body. We are equipped to be healthy. Like, that's why we are like billions of years and we're still around, even though we don't necessarily take the best care of ourselves.
Yeah.
And we do so many things wrong. So that's why we're still around. Because there's the resiliency in the body, but then we just got to keep going toward the harmonic aspects of things.
Dr. Sami, literally, my son will not stop complaining about his ears, and he does not have an ear infection, but we've been trying to figure out what it is. And we are assuming there's wax buildup. And so everything you say just is makes so much sense. But for children, it's really hard to remove. That's the other thing. How do you even do that? I'm always curious, does a doctor do that? Because for us, we are putting in, when I can, mullein oil or garlic oil in there. But I'm is this actually going to get the wax out?
Not really, but I would suggest, because unless you really know the ear's anatomy, it's best if you ask a nurse or a doctor. I once in a while kind of do that as anti Dr. Sherry. It's just a bit as a service, to some of the parents, because there's specific instruments that you can actually do that, and you can clean up the things. But again, you're going back to the source.
Is there a difference in what you see in terms of your pediatric patients and when their teeth come in, or the quality of their teeth, depending on what the mother is eating? I'm super curious about that.
So if, not necessarily looking at oh, you have to eat this, you have to eat that, but something like Korean culture where, their moms come to their house and for so many days, all they have is this seaweed soup, for, I don't know, for 2 weeks or 40 days or whatever they have. But I do see all of the benefits of the cultural aspects. Or the Indians, they do this, many of them, even they are vegetarians, they do a lot of high fat stuff, like ghee and coconut and, lentils and all of those things, that it's very, very mindful, And those people, they have absolutely no medical knowledge, but I feel that there is a wisdom that has been collected throughout generations that we're just bypassing right now. We're kind of coming up with our own versions of things, and soy and all of those things that we are substituting, but we don't know what is the long-term thing, versus we know that, hey, Indian culture, for example, they thrived on a vegetarian diet, not a vegan diet, but a vegetarian diet. But they did also use a variety of Ayurvedic medicine in order to stay balanced. So it wasn't the mac and cheese diet that saved them. It wasn't most of the kids that they consider themselves vegan, all they eat is dairy and bad dairy and gluten. And that's it, basically carbohydrates and, there's no vegetables. So and then the knowledge about all those little things, how the variety of the rainbows in the vegetables, and then how to use the legumes, and especially with our current agricultural practices, and the way that we're not so mindful about minerals and we're depleting our soil, I feel it becomes so much more important to be mindful about what we're putting in. So, and then those things, they affect the connective tissues, they affect the way that the bone and jaw grows, that they affect the way that the rest of your cranium. And what I intend for every single patient is that I set them up not just for now, but I set them up for a healthier life in the future,
Yeah.
because it's not just the childhood. And then the whole statistic of 2018, I think they were talking about 50%, one out of two child has chronic disease issues. And they were expecting that by 2024 or 2025, 80% of our children have chronic disease issues.
Wow.
To me, it's just heartbreaking.
Yeah.
And I want to see, like, how can me as an individual be a part of that statistic would not happen. What can I do in my little tiny ways, that statistic changes, and we don't have so many kids with the chronic issues, because we used to have all these mid 30s with the chronic issues. Now it's kind of getting younger and younger, and I think it's really, really heartbreaking for me to see that. So that's why I want to kind of like set them up for a different future.
Yeah.
By taking care of like all these little, it's like, how's the gut? How's the nervous system? How's the stress? How's the eating function, food, all of that stuff, receiving, anxiety, like there's just all these little parts. Then collaborations with so many people, then you can, perhaps we would never have to have that statistic for 2025.
Yeah, no, it makes sense, because I think when you get them early on, then what you're working on is prevention versus then, dealing with, okay, I had a root canal, I had this, and then those things are affecting my body. Whereas what you're saying is, okay, what's showing up in your body, let's heal it before it turns into something in your mouth. And your mouth is going to tell me what's going on in your body as well. But hopefully it's not something that we, happened and then we come in later and say.
Yeah, and learning those early signs, right? Such as the hiccup. It's like learning those early signs, like what are some of the things that, I had been talking about this for a long time, that what you eat and what you do and all of this stuff, it does have an effect on your child, even pre-pregnancy. And I listened to a lecture, and I love the fact that all of these things are slowly making themselves to substantial universities, such as UCLA. But in the same lecture that guy was talking about, the xylitol, he also brought forward, that they did a study, and I still haven't looked for the study. I have to look for it, but they did a study where they found out the antibiotic that mom took 9 years pre-conception they found the strand in the child's body, right, of that antibiotic.
Wow.
That doesn't mean there's anything wrong with the child.
Yeah.
It just means there is an aspect that it actually, just understanding the consequence of some of the things that we do. And we have to do that for acute situation. We have to do that for like necessary steps. However, the mindfulness is the key, right? Not just like everything, like kind of my mom, she would like get anything. As soon as she would wake up and there was anything hurting, she would go and take antibiotics. Yeah. I'm like, my mom, take an antibiotic. Yeah. I don't know, maybe it's an infection, or she just like took those Tylenols and Motrins like they were candies, and she believed in C-sections, elective C-sections, and no breastfeeding, so all of those things, it's not, it has created some compromise in my body that I'm working years and years in order to release that and in order to counteract that.
Yeah.
But by the same token, I don't blame her necessarily. That was, she didn't know any other ways and she didn't know any better. So it's not, and it became, and I hold it as like this sacred journey for me, that all of those things, it actually brought me to a more space of compassion, more space of, curiosity, more space of, this persistent of wanting to learn deeper and know more, and then be of service to so many people, within my practice or globally. So I don't hold it as a bad thing, but I hold it as, it's like she didn't know any better, and then this is how it has served me as well.
I think also like that generation, it's like they come from a place of fear when they do that too, because it's like, oh my gosh, so many people died and this happened to people. And I remember my dad saying, because I was saying to him, isn't it cool that you guys in Iran had your milk delivered to you and it was raw and all stuff? He's like, oh, my mom made us pasteurize it because she was so scared. And I was thinking, wow, because she came from a place of fear. This is how people get sick. And I don't know what it was like back then for them and all that, but now we're in a place of really understanding the benefits of the raw milk, and
we drive all the way to Santa Monica to get that.
Crazy. And so it's funny because I think now it's just coming back into that wisdom that you talked about, like that ancestral wisdom that we have and that we knew, and that Rudolf Steiner totally tapped into. And I think it's so amazing that you're taking his work and incorporating your own, and how wonderful to then have the opportunity to talk to these parents who are like, oh, is my child ready for, because more and more people are homeschooling and can do things on their own timeline. And I know that you're really helping a lot of parents with homeschooling too. And you guys have an amazing farm, or I don't know what to call it, something that you've created.
Mini farm, yes.
Yeah, animals, and how incredible to share that with your children, and then also for us to be able to see it, whether it's on social media or, whatever. I think it's just a way back to nature. And I was thinking about this the other day because someone was saying, like, this is the time where the more, like, as many of us that can get back to nature's natural rhythm and sleeping when it's dark and waking up when it's light, and all of those things, then we're all naturally going to be able to feel like what you feel when you touch that child's head and you know that he's vibrating and something's off, because that's not how we're meant to naturally feel.
Right. Right. Absolutely. Yeah, and incorporating some of those practices, right? It's for example, our son Hafez is he's in charge of the farm, right now.
And how old is he?
He's 13 and a half. So he doesn't have a phone, and because again, Rudolf Steiner's like 14 years old, they're just, the frontal lobe starts to develop. So you can't give a phone to your child and expect them to make great decisions because there's no frontal lobe yet, to make those logical decisions, and so it becomes based on all these rules and regulations, which, depending on what age and the temperaments of the child, it might become more of a struggle rather than a bonding relationship. So he knows, and so he doesn't have a phone, and we don't have video games in the house, so he's doing a lot of farm works. But one of the things that I, and then also we are homeschooling, both kids with like a little farm school that we actually have in our property. But one of the things that I see is like all these anxiety, at least that I see in so many patients now. Cause and then the kids constantly complaining. It's like, I hate Zooming, and I hate being muted. I hate, all of these things. Like, I see that because my kids are so much in nature, and at least with animals, and a few kids, that were kind of like, minding the health and minding the safety and all of those things. But at the same time, they're able to connect and collaborate with Mother Nature, growing our own food, learning how to milk the goats. I mean, both of them, they're amazing at milking the goats in the office, can do like 18 goats in like an hour. So it's so cute to see how, and then like this level of confidence that has come up, responsibility. We've started to pay him for his work. And Rudolf Steiner talks about all of that stuff. He talks about the 12-year changes and how that part of like wanting to be accepted and then all these rise and fall of the hormones and emotions and feelings, and then getting them engaged in things that they are nature related, whether like, cutting woods or, taking care of animals or gardening, and that's why most of the Waldorfs, they have like biodynamic farms and things like that. It actually allows them to understand that the rise and fall of the feelings and the thoughts are temporary. And you can through the connections with nature and through, hard work, you can actually kind of ride through all of those, different emotions that they pop up, and then you can ground yourself. And it's wonderful to see the changes in him as a young man in comparison to the rest of the teenagers that I see, where they're like constant, they don't even lift up their head from their phone. They don't make any relationship, no eye contact. They're not very confident. They have a hard time speaking with an adult, So it's just all these like subtle and yet profound understanding about the brain development and the understanding of the connections with nature, like the kids, for example, that, Hannah's age, like 7, 8 years old. We've had a lot of baby goats, and they can't wait to go to school.
Aww.
So they call the baby goats, and the baby goats, they climb all over them in the middle of their, they have an outdoor setting, they climb all over them while they're learning. But it's so much more than that. It's like where their food is coming from, how, they have witnessed so many babies coming, some goats dying and not making it. They have buried, some animals. So like the whole cycle of life and death, connections, and how interdependent we are to each other, and how we are part of nature. I think there was a talk that Zach Bush gave a few weeks ago on a Zoom call, and I loved. I still get chills from it because he started with definition of nature in Oxford Dictionary, which included animals, plants, environment, soil, as opposed to humans and human creation. So he questioned, is like, when did we start putting ourselves in opposition with nature? Not part of it, but in opposition of nature. And when we feel included in this whole majesty called life, then I think there's so much wisdom that comes through that it's missed when we just look at things like, oh, one virus, one bacteria, one this, one that, and then just, staying in our busy lives, running, and not necessarily ever going outside and walking bare feet on grass, or sand or whatever it is, because we've been too busy in any ways connecting, in any ways, like looking at, I don't know, like we have these 350 years old oak trees in our outside of our house, and we look at it, it's like, oh my God, what stories you have to tell me.
Yeah.
Nights I just sit underneath it, and kind of like underneath it, not quite, but I sit in front of it, and I just meditate, like, what stories, how many fires have you seen? How many challenges you have gone through, how many things, and you're still surviving in this beautiful, magnificent ways. And what metaphors I can use out of that in order when I'm going through my own challenges in life, and not only surviving them, but thriving because of them, and so much lessons that I can gain in this majestic, being, which is, it's really has so many stories to teach us, right?
Yeah. It's so beautiful. I love what you've created, and I love your perspective, and it's so incredible that people can come to you, and you can still meet with them in person, whether it's at your office. I'm sure you're doing Zoom, and really guide parents through this time, because it's not easy, and knowing that you're there to support is really, it makes me feel good and at peace, and I wanted to share that with our listeners. So I appreciate you so much.
Thank you. Thank you so much for having me. And it was a wonderful conversation. I really enjoyed it. Thank you for doing all the stuff that you do to bring a little bit more light and loving to this world, and just shining your own light in all aspects of things, with my beloved, with all these amazing people that they are that you're also interviewing through your podcast. So I send you and your listeners so much light and loving, especially during these challenging life times, because we all need to shine our lights in order to get to the other side.